Namaskar.
Namaskar.
Thanks, Abhayji, for accepting our invitation. We want that those who wants to get their hair transplant done, but they are afraid of some complication, they have some fear of getting something wrong done with them. So that's the only intention. And your real experience, whatever you felt, good, bad, pain, no pain, comfort, discomfort, so you express totally just to convey the message. So what was the problem, Abhayji?
Okay, so a bit of context. I had something done in 2016. At that time, the doctor who actually did the surgery kind of made the case a bit complicated. There were a few issues. One of the issues was my hairline was all the way up till my forehead, and it was going straight. So what that means is it looks very artificial and it's not natural. The second complication was in the donor area, because it was already done. In the donor area, the graft quantity that was able to be retrieved from there was max was around 1500 to 2000. So what Dr. Garg actually did, he kind of worked around it and he managed to retrieve 2000 grafts from my hair, my scalp, and then remaining 3000 grafts from my beard. And as you can see, there are no marks or nothing like that, and there's still plenty of beard there. And based on my personal experience and the quotes that I got from other people, if there was anyone else who would have examined me before the surgery, they would have said no, because there wasn't anything left in my donor area. Everything was depleted from there. In terms of the pain and the comfort level, I would say you're not going to be feeling any kind of pain, and you will feel pretty relaxed. And the staff and the technicians, everyone is very friendly, and they make sure that your comfort and your relaxation is their utmost priority. And Dr. Garg, you have to meet him in order to really understand his personality, and whatever you're seeing in the camera and whatever you're expecting is going to be 10 times better when you're actually here. So that's my feedback. Yeah.
Thank you, Abhayji. I really appreciate your kind words and your great experience. To just tell about what was the wrong with the case. I don't blame anyone. It depends on the knowledge of the individual, and everyone does as per his knowledge best out of that. But we all know that knowledge has got the limitations, so has the learning curve also. So in Abhayji's case, if we say the hairline was too low, which is mostly many times the patient asks for that, they want the hairline of age of 16 years when they were teenage, and they wish, of course they have, it's right for that they want the hairline, but I tell you the hairline can be made 16 years but the face changes, so it mismatch. Another thing, if someone makes the low hairline, it needs very high density, and rest of the scalp area also needs, because it is going to become bald in the future. So looking into that, there will be more demand of the donor hair follicle, and donor supply is limited. So in that case, if you consume all the donor supply in the front area, making a lower hairline, the rest of the donor area will be depleted, as in this case was. So when we shaved the area, there was a lot of scarring was there, and most of the donor area was depleted, but even then leftover area we could harvest 2000 healthy graft, and he has got the excellent donor area hair follicles which were left. Another thing was, we wanted more and more graft to cover his bald area, so we took the graft from the beard, and 3000 grafts were taken from his beard, and it took quite a lot of time, but Abhayji was quite good in cooperating. He followed all our instructions, he cooperated like anything, so it becomes easy for us to harvest 3000 grafts from the beard. And yesterday we did, and he has done the shaving, and you can see this is the area from where we have taken, and you can't feel that we have taken 3000 grafts. Even after taking so many of graft, you can shave. So he has shaved in the morning and he's in front of you and he's comfortable. So that's the only thing I want to convey. And another thing, what we did, the wrong hairline which was made low, it was quite abnormal, unnatural. Multifollicular units were put, they were looking unnatural. You can see in the pictures also. So me and my wife, Dr. Seema, discussed a lot on this issue, what can be done. So what we did, we removed around 200 grafts from the wrong hairline. So this hairline was low, you can see here. So if I make hairline low, then my demand will increase and it will look unnatural. So for that, what we did, we almost a centimeter, 10 mm area, we took out the grafts which were abnormal, unnatural, multifollicular unit and in different direction. So we took out, and out of 200, 180 were intact hair follicle which we implanted again. So we did not lose them. So this is the condition, and we redesigned the hairline, making it normal. Although I wanted a little higher up, but it was not possible to go further higher up. So that's the condition we made. So I think it's pretty good now. I'm not advising that you come to me. You go to a senior person. Go to who has enough experience, who has academic orientation. He can understand your problem, that he should know how to correct a wrongly done work, because it's a big challenge. It's a big challenge and required a lot of experience and high quality of instruments, which we had. And I don't think so he will have mark over the forehead. So that's what. So thank you, Abhayji.
Thank you.
Good enough. We appreciate your kind words and devoting so much time for our patients.
Just a tip for anyone who's thinking of getting the hair transplant. People are actually going to promise you the world, and they're going to be saying, yes, we can achieve this, we can do this, do that. And then there are people who are going to be playing tricks with you, not by saying you the number of grafts, they're going to be saying the number of hair they're going to be implanting. So be careful of that. Just ask them the total number of grafts, not the total number of hair they're going to be implanting. Second thing is, make sure whoever you're going is experienced and have actual physical checkup done, because they're going to promise you the world, but when you are there, they're going to be saying, oh, we can't really achieve that, but we'll try our best. And what that means is going to undergo all the surgical procedure, but you're not going to get the optimum result. I highly recommend you Dr. Garg, but it's up to you, whoever you like to go with. All the best. Thank you.
Thank you. Thank you. Thank you.